Hey everyone, in this video we are going to review complementary and alternative medicine, so stay tuned. Welcome to CassRN, where I teach you about all things nursing. As a quick introduction, we are going to go through the categories of CAM, which is also complementary alternative medicine, and some healthcare practices that are related to those things. One caveat that I really want to add to this before we jump too far into this lecture is that a lot of people use complementary and alternative medicine and are afraid to come into mainstream Western medicine when they're using those because they're uncertain how they will be received. If you look at my herbal remedies video, you'll probably find some things that you yourself have used. So just make sure to be understanding of these people and don't make them feel less than for using an alternative form of therapy that they feel is really important. Treat them with respect and kindness, because the reality of the situation is that herbal remedies and alternative medicine cannot treat everything. There are times when you've got a broken bone or you need surgery because your appendix has burst, and we want those people to come to us when they need help. So make sure to treat people with significant respect and understanding of their approach to healthcare so that when they do have an emergency, they will not feel like they can't come to us. So first off, let's talk about complementary versus alternative. So if a non-stream approach is used together with conventional medicine, then it's complementary, right? So they complement each other. Then if a non-mainstream approach is used in place of, then it's considered an alternative because they're not using conventional medicine. And that comes from the National Center for Complementary and Integrative Health. So complementary medicine can be classified based on the therapeutic input or how it's delivered into the body. So we've got nutrition. This is usually herbs and vitamins, minerals, probiotics. These are products that are most commonly used and frequently marketed to the general public. They're easily accessible, and there are risks of interactions with pharmaceuticals, so it is important to know what your supplements are, and you need to know what your patients are taking to make sure that they don't interact. So make sure to watch my video on herbal medications and herbal remedies so that you can be aware of some of those. Then we've got psychological and physical. This category includes a lot of therapies commonly used by adults, and research shows that many of them are very helpful with a multitude of health conditions, such as acupuncture, which can help decrease chronic pain in joints, reduce blood pressure, anxiety, depressions, and even symptoms of IBS. Tai Chi helps improve balance and stability, which reduces back pain and improves quality of life for people suffering from chronic diseases. And yoga can help reduce stress and supports good health habits and can help with other types of chronic pain, anxiety, and depression. Okay, so we've got psychological, physical, and combination that those categories fall under. The combination category typically affects multiple areas, such as the psychological and the physical, like yoga or Tai Chi. So this is commonly called mind-body practice. These are some systems, they're whole systems that are used to treat problems rather than just one type. So we've got traditional healers that are used in a community. We have ayurvedic medicine, traditional Chinese medicine, homeopathy, naturopathy, and functional medicine. So we're going to go through all of those. So first off, we've got our traditional healers. And this is someone who is recognized in the community in which he lives as being competent to provide health care. Based on those communities, these traditional healers are going to treat based on the beliefs inside those communities. So some examples that you might see are like medicine men or shamans. You also might see midwives and herbalists used in various communities. Then we've got the Ayurvedic medicine. This is practiced in India, and it's based on ancient writings, and it does rely on natural and holistic measures. It is also the world's oldest known medical system and generally combines plants, animal products, metals, minerals, and diet, as well as exercise and lifestyle. Then we've got traditional Chinese medicine that has evolved over thousands of years. There's acupuncture, which consists of stimulating specific trigger points on the body by inserting needles through the skin. Studies have actually shown that this can help with some types of chronic pain. Tai Chi is a combination of postures and gentle movements that encourage mental focus, breathing, and relaxation. And studies have shown that this can help improve balance and stability, as well as helping with some chronic pain. And herbal products. Homeopathy was developed in Germany around 200 years ago, and it's got some interesting concepts. There's little to no evidence that supports its effectiveness. There hasn't really been much study done on this. That's really what it boils down to, is that there hasn't been good quality research done on homeopathy. There's a couple of concepts that it has in like cures like. And so this is the idea that the cure can be found in a substance that produces a similar effect in a healthy person. So if there's a medication that's going to cause fever, if somebody has a fever, then in homeopathy, they would be given that same medication and it should cure the fever. So there's that concept. And then there's another concept called the law of minimum dose, in that the lower the dose, the more effective it will be. None of these approaches are approved by the FDA, and it's typically individualized, consisting of plant, mineral, and animal products, and also uses sugar pellets, ointments, gels, drops, creams, and tablets to be able to get it into the body. Then we've got naturopathy. So this has evolved from use in the 19th century Europe. You'll see it in a lot of different areas. There's actually a graduate school for naturopathic providers. So depending on the state or territory, licensing may not be required, but if it is, then that physician will need to complete their education and then take a licensing exam. So this is a graduate school education, and currently licensure is offered in 23 states and 2 of the territories, Puerto Rico and the Virgin Islands. So traditional naturopaths might go to training, but they're not usually eligible for licensing. And then providers may integrate this naturopathy into their practice. This is going to focus on lifestyle changes, stress reductions, using herbs and dietary supplements, homeopathy, exercise, detoxing, and psychotherapy. And again, there are those 2 different types in both graduate schools and then traditional naturopaths. Then we've got functional medicine. So traditional medicine is going to presume that the certain symptoms are aligned with a specific body system, right? So for example, if you're having shortness of breath and you're bent over trying to breathe and you're having chest pain that's radiating down the left arm and up to the left side of the jaw, these are very typical examples of a heart attack, right? So this is a really basic thing. So then in functional medicine will dig deeper to find the root of the problem and then treat that problem, which then should alleviate the symptoms. So obviously in cases of a heart attack, you need to go to the hospital, you need to get checked out. There's lots of things that they can do for you there, and this is an extreme example. I would not ever recommend that you just go to a regular doctor's office or someone who practices functional medicine for a heart attack. You need to do a lot more than that. But the aftercare, we might want to look in that and seeing if there's a cause even further down from just the actual heart attack, and what we can do to prevent heart attacks from happening in the future, and what the original cause of that heart attack was. So that's why I put this picture up here of these flowers with their roots, because functional medicine just focuses on the root of the problem. All right, quick review. So we've got a lot of different categories when it comes to complementary alternative medicine. Lots of people are going to use them based on their own ethnic origins and history and their personal beliefs. So the categories are how the therapy is consumed. So we've got nutritional, psychological, physical, and then a combination, and then the various practice techniques, which are traditional healers, ayurvedic, traditional Chinese, homeopathy, naturopathy, and functional medicine. So again, if you'd like to know more about those herbal remedies, please make sure to check out my other herbal remedies video. Thanks for tuning in. Please help me grow my channel by clicking subscribe and follow below.